I think I have a prolapse. What would I be experiencing and what can be done about it? Hi there, welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. This is Justine Calderwood, pelvic floor physical therapist and birth recovery specialist. In this Ed Talk today, I'm going to break down prolapse is a really big subject, so I'm going to break down the different types of prolapse in different videos. So today we're talking about anterior vaginal prolapse, which can include cystocele or urethrocoele. So let's talk about that a little bit more. Here I have a female model of the pelvis. We're looking down here inside of the pelvis from the front side. So you can see right behind the pubic bone here, we have the bladder, we have the uterus, and the rectum. So when we're talking about an anterior vaginal prolapse, it's really along the front side, and that can include the bladder, the urethra, or both. So a bladder prolapse, where the bladder has come down a little bit, is called a cystocele, and a urethra, when it comes down in prolapse, it's called a urethrocoele. So that's a little bit of that model there. So let's talk about some symptoms that you may be experiencing with a anterior vaginal prolapse. One thing that you might notice is just a lot of heaviness and pressure into the pelvic area and down into the vulva or the vaginal area. On this little model here, you might even be able to see, like if you were to open up the labia, you might even be able to see a little bit of pink tissue in there at the vaginal opening, or it may just be a sensation that you feel, like almost like a tampon that's fallen down a little bit and is a little too low. Another symptom that you might experience is urinary incontinence or leaking. You may have difficulty starting your urine stream, or you may even have a weak urine stream. Another symptom is possibly not being able to empty your bladder completely. So you might feel after you stand up that you might have a little bit of dribbling, or there just might be a sensation of still some fullness in the bladder. And for some people, they actually find that inserting a finger or two into the vaginal opening and giving a little bit of pressure to the bladder helps them to actually empty their bladder a little bit better. Now let's go over treatment options for prolapse. One is exercise. You want to do exercise where you're not pushing yourself too much and causing a lot of downward pressure into the pelvic area. So learning how to manage the pressure into your core, into your abdomen, so that you're not causing undue pressure downward. I prefer low pressure fitness as a form of exercise because it helps to create kind of like a plunger effect, and it helps to lift those organs at the same time that you're strengthening. Pelvic floor training is another treatment option. So while we look at strength, we also want to look at the coordination and how well those muscles are functioning. Are they doing what they need to do at the time that they're supposed to do it? Manual physical therapy, so using our hands in order to help tight areas that may be pulling onto those organs. So checking the uterus, checking the bladder, and all into that pelvic area. Wearing a pessary is a treatment option. A lot of people find relief with this, and for some people they wear it all the time. It's just a silicone support system that goes into the vaginal canal to help lift up and support those organs. For some people, they use a pessary just when they're exercising. So there's a lot of variability when it comes to pessary use. Learning modifications to how you're lifting and how you're using your body on a day-to-day basis. If you have kids, like how to actually lift them properly, and again, managing pressure into the pelvic area and the core. Going over proper posture and really learning about your body and using it more efficiently. And the last thing is support garments. There are things like even something simple like these Spanx that can be really supportive into the pelvic area, into the core. And another option is this garment. It's called a femme jock, and this can be really supportive for some people that feel a lot of, say, bulging right there at that vaginal entrance. So this just is worn underneath the outer clothing, but over top of the underwear. If you have a cystocele or suspect that you do, maybe you've been diagnosed with it. If you have further questions on what can be done for your particular case, please reach out. Request a discovery session with myself. I'd be happy to sit down with you face-to-face or via video and answer any questions that you have and talk about treatment options. Thank you for coming to my Ed Talk.